Meet Miguel. Miguel is a 25-year-old Latino male who is visiting his healthcare provider, Dr. Bell, for an annual checkup. Miguel has asked to receive an HIV test.
Hi, Miguel. I'm Dr. Bell.
Hello, Dr. Bell.
So, I understand you want to have an HIV test today. Is there any particular reason why you want to be tested?
Well, I got an HIV test about a year ago, and I thought it was time to get another one.
Great. You know, I recommend that we test you for other STDs as well. Do you feel you're at risk for other STDs?
I guess so. Before I started dating my boyfriend, I used condoms most of the times when I had sex with other guys. But since I've been in a relationship, I don't always use condoms.
You mentioned that your last HIV test was about a year ago. How many people have you had sex with since then?
About 3 or 4 in the last year.
Okay, and were these partners male, female, or both?
Just guys.
Okay, and when you say sex, do you mean oral sex, anal sex, or both?
Both.
You said you use condoms most of the time with your sexual partners. Can you tell me how you protect yourself during oral sex?
I don't use condoms for oral sex. Why? Should I?
Well, it's less likely, but it is possible to get HIV through oral sex. But other STDs are easily transmitted this way. Have you been tested for any STDs other than HIV?
Yeah, when I got tested for HIV last year, I think they tested me for other STDs. They did a pap smear.
Okay, an anal pap smear. Are you usually the bottom or receptive partner when you have anal sex?
Yeah, almost always.
Thank you for answering all of my questions, Miguel. I know it's not easy to talk to someone about sex that you don't know very well, but it is important in order to keep you healthy.
I understand. Thanks, Dr. Bell.
So now I'm going to give you an HIV test. And based on what you've told me, I'd also like to test you for chlamydia, gonorrhea, syphilis, and herpes. What do you think?
I don't know. What will you have to do?
Well, I'll have to take a urine sample, a throat and rectal swab, and a blood sample to test for HIV and other STDs. Is that okay with you?
Yeah, sure. Let's do it.
Hi, Miguel. Great to see you again.
Good to see you too, Dr. Bell. I'm anxious to hear my test results.
Well, your test results for HIV, chlamydia, and gonorrhea came back negative, which is great news. I'm still going to recommend that you come back for another HIV test in about 3 to 6 months, because if you were recently infected, the test may not show it. How does that sound to you?
That makes sense. I can do that.
Now, your test results for syphilis and genital herpes came back positive.
Oh. Okay. So what happens now?
Well, I can give you medication to treat the syphilis. As for the genital herpes, well, there's no cure, only medication for outbreaks. Have you had any outbreaks? Any painful sores or blisters on your genitals?
No, never.
Okay, well, that's not uncommon. Some patients don't have any symptoms, but if you do have symptoms, I can prescribe a medication to manage those outbreaks. This will shorten their duration and maybe even stop them from happening again. Based on your test results, I'm going to recommend that you use a condom every time you have sex. This is important to help protect your partner from becoming infected, and it'll also help protect you from any other STDs. How do you feel about your test results today, Miguel?
I'm pretty shocked, actually. I definitely wasn't expecting this. I never had any symptoms at all. Now I'm gonna have to tell my boyfriend.
How do you feel about talking to your boyfriend about your test results?
I'm nervous, but I know I have to tell him.
That's a good idea. And I recommend that he come to the clinic to be tested for HIV and other STDs. I would also like to speak with him about how he can protect himself.
Okay, I'll let him know. Thanks, Dr. Bell.
You're welcome, Miguel. Do you have any other questions I can answer for you today?
No, I think you've explained everything I needed to know. I appreciate it.